This suicide prevention training is for all faiths. We have another training that is designed specifically for Christian ministers. This training is an evidence-based, based on scientific research. It's a practical course designed to improve the confidence, skills, and knowledge in both the assessment and management of people at risk of self-harm and suicide. So the Christian suicide prevention training is really different from the evidence-based, based on scientific research. Different, very different from this suicide prevention training for all faiths. The Christian training is concentrating and focused on the Word of God and bringing hope to people from the Word of God. I've been involved with helping young people and all age people really with suicidal issues for the past 6 years as a minister. So I have got a lot of materials when it comes to the Christian perspective on how to bring hope to people. But this suicide prevention training here is for all faiths, and I wanted this particular training to be evidence-based training based on all the scientific research that's out there. So the ministers and clergy that will look at this training will be better able to, the goal is to help improve their interview skills in evaluating suicidal risk, increase confidence in dealing with people who are suicidal, improve attitude of ministers and clergy in dealing with people who are suicidal, be able to talk with suicide with a person at risk in a straightforward manner, and demonstrate the skills required to intervene and give hope to a person at risk. And of course, get the necessary help that the person might need in the event of a crisis. And also to commit to helping and coordinate help from social and professional supports likely to promote suicide safety. So what will be covered in the suicide prevention training for all faiths? Well, first of all, it will improve the attitudes. Again, there are lots of myths out there associated with suicide. We want to go over that so you'll have a good idea as a minister or clergy, how to tackle, how to change your attitude and change the attitudes that are out there. There are a lot of myths associated with suicide, and we want to talk about that. Next, we'll look at Ask and Listen. And this is about talking about suicide with a person at risk in a straightforward manner. This is very important, and studies have shown that talking about suicide and asking questions and listening to people, showing compassion, really reduce the suicide rates. So we'll go through that. And then next we'll talk about the intervening process. Intervene with compassion and hope. What we're trying to do is bring compassion and hope to these people that are suffering in this way. And as ministers and clergy, that's part of our job. So, most of us know how to do this. And again, we're talking about bringing hope and compassion. The next step will be referral, or what we call getting help. This is also necessary when you're talking about working with people in a crisis. We want to help them as ministers. We want to take that person, we want to help them, and we want to take them to a counselor, take them to a mental health professional, and do whatever is necessary. But it's best if we could do this ourselves, if we could actually take the person ourselves. Next, we'll talk about some protective factors for suicide. We'll look at a list of protective factors to reduce suicide. Again, good information to know what is out there. And then the last thing to look at here in the training will be risk factors. It's good to know what the risk factors are that are associated with suicide. So we'll go through all these in the training. So this training will talk about hope, and that's what we're doing here. We're trying to bring hope to the person along with developing some other skills. And again, in the Christian ministers training, we'll talk about hope from a different perspective. But here the training is a positive, hopeful intervention, and by doing this, by bringing hope, we believe it will reduce the risk of premature deaths by suicide. Again, the science has shown that just by the act of listening will bring hope to a person that has no hope. And the training is not intended to be any form of counseling or treatment. But hope begins with you as a minister or part of the clergy. Hope begins with you. And here's a list below of all the websites that basically have a lot of this information. So what to do as a faith leader? Well, first of all, in this situation, you need to be able to stay calm and take all threats seriously. It's very important, matter of fact, it's critical to ask direct questions about the threat of suicide. So also to connect the person with resources, and if there's immediate help is required, then there's some hotlines you can call here, like the National Suicide Prevention Hotline. Also important to stay with the person if you can. Try and accompany the person to the hospital or wherever you're going to take them for help. In your own faith community, you can do a lot of things to help in this situation. You can talk about the spiritual and mental issues here. You can encourage your congregation to provide support. Again, support for people that are at risk is crucial. And also, the education of your faith community is very important. Helping them educate about the warning signs and the community mental health resources that might be around. So in your faith community, it's important to get your community involved in this issue. And the idea and the goal is to reduce deaths from suicide. In your faith community, what does your faith bring that might help in this situation, to promote mental and spiritual help in your faith, to help in suicide prevention? Any kind of narratives of hope and prayers that bring hope and break the silence, and then get people to be able to connect in the community. Advocate for improved mental health care and suicide prevention education is also very important. So let's look at dispelling some myths that are out there about suicide, and there are many. And going through these facts here, I'm thinking that it will change your attitude, the way you look at suicide and some of the myths that are out there. Suicide accounts for relatively few deaths in the United States. That's obviously false. I think people are actually beginning to be aware of this now. Again, these numbers are unbelievable. Each day, approximately 86 Americans commit suicide, and 1,500 people attempt suicide. Those for age 15 to 24 years of age, suicide is the third leading cause of death. And for every completed suicide, there are 25 attempted suicide. Just think of the devastation in these families that's caused by an attempted suicide. So for every suicide, at least 6 other people's lives are affected. So this is a major problem, and we would like to see much more ministers and clergy get involved in this problem and help bring these rates down. Another myth: young people never think about suicide. That's obviously false. Suicide is the third leading cause of death for young people. Sometimes children under 10 die by suicide. Here's another myth that can cause some problems. The myth is that talking about suicide will plant the idea in a depressed person's mind. This is false, based on lots of studies that have been done. The myth is one that costs more lives than it saves. Suicidal individual is actually relieved that somebody has finally noticed his pain and will listen to them. Again, we're bringing hope to the person by talking to them and listening to what they have to say. Talking about suicide decreases the troubled person's vulnerability by reducing his isolation. A person isolated in his pain is much more likely to commit suicide. So talking about the issue is a vital part of this training. People who talk about suicide usually don't follow through with it. False. Suicidal people really want help, and talking about killing themselves is a cry for help. So many people, through fear and ignorance, do not acknowledge this cry for help and refuse to get involved. That's why, again, as ministers and clergy, people that come to us as mentors and come to us for spiritual guidance, we need to get involved in this area. And it's an obvious one that we're obviously not involved too much. We can tell. So be sure that you can be sure that when somebody talks about suicide, they are seriously considering it, and we must take it seriously. Most suicides occur without warning. This is another myth, and it's false. It may seem like that, but when we look into the situation, we usually find, the studies have found that there usually are warning signs. Any of the following are clues to a suicidal mindset. There are many of these: withdrawals, moodiness, depression, aggression, or risk taking, alcohol and drug abuse. And we'll go into these at the end of the training here. We'll go into the risk factors and talk about this a little bit more. And again, it may appear to the family that the event was without warning, but usually after looking into the situation, it usually reveals that there were warning signs. And that's what we want to be aware of and look for. We want to be aware of the warning signs in a person when we talk to that person. The tendency towards suicide is inherited. This is false. Suicidal behavior patterns do seem to follow family lines, but there is no genetic disposition to suicide. Another myth, that if there is no note, it was not a suicide. False. 2/3 of those who commit suicide do not leave a note. When depression lifts, suicide is no longer a concern. This is also false, and it can be dangerous because when a depressed person experiences a period of apparent improvement, his overall condition may actually be one of greater danger. They may have the improvement may be a result of resolving to go ahead with the suicide, and relief that the struggle of making the decision is over. And there is scientific evidence to prove this. That's why it's good to have the evidence-based reports on these issues, because we know that this kind of thing can happen, and we can be aware of it and be looking out for it and be able to do something about it if this situation comes up. And here's another myth that's also dangerous. And there, as you can see, there are these myths that they're dangerous, having these attitudes. So it's important to have our attitudes changed. A suicidal person cannot be talked out of it if he or she is intent of dying. This is a myth that's out there. And almost every suicidal person is struggling with the decision to live or die. And there are usually two internal voices shouting yes and no. And to save a life, it may be somebody like you as a minister to come in here and intervene. A person wavering between choosing life or death, a concerned, compassionate external voice can tip the scales to the side of choosing life. And again, just listen to this person offering hope is what can really save it. It can save a life. Again, the evidence shows this. However, there are some situations where no matter how hard an interviewer tries, the person is past the point of no return. Women threaten suicide, but only men follow through with it. False. Although women make far more suicidal gestures than men, they attempt suicide 3-1, but usually choose slower acting, less lethal methods, such as prescription medications. Men make far more attempts. Suicidal behavior in men seems to be more lethal. Men complete suicide about 3-1 because they are more likely to use faster acting, more lethal means such as a gun or a car. So men try harder and they succeed. That's why the numbers are what they are. Only certain people are the suicidal type. Again, this is false. Although some people are at a higher risk of committing suicide, there are no suicidal personality types. Suicides tends to be a cross-cultural phenomenon affecting all groups. Only insane or crazy people commit suicide. False. A person who thinks about or tries to commit suicide is not necessarily insane. It is very possible for negative thought patterns and depression to overtake anyone to the point of wanting to end it all. Again, the studies have shown this very clearly, that lots of people can be accessible to this type of a problem, and many of us can get into a situation where we have depression that comes upon us. So if somebody in your family committed suicide, that doesn't make the person or you crazy. This is very sad because this stigma is still attached to many surviving families in our society. And we need to, again, address some of these stigmas and get the truth out there and have people come out of the shadows and be able to talk about mental health issues. People who commit suicide haven't sought medical help prior to the attempt. This is also false. Many times physical ailments accompany depression, for instance, and suicidal people often go to medical treatment for physical problems before the attempt. A lot of times people seek counseling but get discouraged when they don't see immediate results and discontinue counseling. That's where ministers and clergy again come in here. We should, and we must play a role here. Lots of people come to ministers for counseling and advice and spiritual leading. So when if they come to us and we offer them hope and we listen, we can reduce these numbers. And it's imperative that the ministers and the clergy get involved and understand and get involved in this problem and help and come with this and be part of a solution. People who talk about suicide are trying to manipulate others. This is also false. People who talk about suicide are in pain and need help. And telling them they just want something or are trying to manipulate is insensitive. People often talk about suicide before dying by suicide. Always take care to talk about suicide seriously, always, and be able to address and talk about the question directly. It's important to be able to ask, talk, and listen to the person and ask direct questions. This is the end of the suicide prevention training, part 1, for ministers, counsellors, and clergy of all faith. Please continue on to part 2. Thank you.